Okay, so when you log in, the profile that you're going to want to use is you're going to want to use your claims processor provider. If you have claims view or your claims submitter, I would recommend just using the claims processor. Your claims processor is going to do the same as your claims view and your claims submitter and offer you just a little bit more flexibility when it comes to submitting claims directly into PRISM. Once you get into PRISM, this is my screen and your screen will look a little bit different. But once you do get into PRISM, you are going to want to go to your Claims tab. And it doesn't matter what type of provider you are, you'll still see Submit Professional, Submit Institutional, Submit Dental, and you'll also see Search Template. If you enter in information for a claim, and you decide to save it instead of submitting it, it will save as a template, and then this is where you'll be able to find those claims that you've saved as a template. So like I said, we're going to go ahead and click into Submit Dental. And up here at the top, you'll see that we have basic claim information. We have provider, we have beneficiary, we have the claim, and we have service. And if you noticed, each of those were highlighting as I hovered over them. What that is it is a link to go directly to that section. So this will take us directly to this provider section. This will take us right to the member, the claim, and then the service line. When you log in, the information for the billing provider is already going to be populated as far as the provider ID and the type. You have an option of entering in the MPI or the provider ID. The dental office does need to have a taxonomy code. If the billing and the rendering are the same, then you would put the taxonomy under the billing. If the billing and the rendering are different, it can go under the rendering provider information. Once you see your information, then you'll just start at the top and we'll go ahead and read the questions and just follow the claim down. It will ask you, is the billing location also the service facility location? If it is not, and you click on no, you'll see that it populates more information for you to fill out. And if you notice the asterisk, that does indicate a required field. We're just going to leave this at yes, which will then hide that information, and then it's no longer required. Is the billing provider also the rendering provider? If you say no, then this information becomes required. If you say yes, it goes away and it is no longer required. Is the billing provider also the supervising provider? Is the service the result of a referral? Is it the result of a primary care referral? You would just answer these questions according. Okay. So we'll move along to the beneficiary information. And what this is asking for the beneficiary ID. This is going to be the member 10-digit ID number, and that is going to start with a 0. And then it's going to ask for the beneficiary last name and first name, middle name, and the suffix. Just make sure that you are entering in the information that is showing up when you do the claim inquiry, not the claim inquiry, I apologize. When you're doing the member eligibility lookup, because if it doesn't match what's in our system, it will deny for the member name. And I have seen where the member has 2 last names, and the last name will be put in as the first name, and then the second last name will be put in as the last name, and then it does deny for an invalid member name. It does require the date of birth and the gender. And right below the member information, it does ask, does the beneficiary have insurance other than Medicaid? We're going to click on yes for this example. And this is where we're going to enter in our primary insurance. Now, this is the insurance information for the whole entire claim. Okay. And so what we're going to do is we're going to fill out the fields that have the asterisk. There are some fields that we do need to fill in that don't have the asterisk, and I'll go over those. The payer responsibility code. For this example, we're entering in primary insurance information. So we're going to go ahead and select primary. The remittance date is not required. The payer ID number is going to be the ID number that you get from your clearinghouse that indicates the different insurance. For this example, under the payer name, we're going to enter in MetLife. The subscriber member ID is not required. The subscriber last name and first name. It is not showing as required, but there are times where it will not let you submit because they want you to enter it, and there are times where it will let you submit. So just as a note for less frustration, just go ahead and plan on entering in that last name and that first name. And just remember that the subscriber information they're asking for is the holder of the primary insurance. Middle name and suffix are optional. In the insured group or policy number, for this example, I'm just entering zeros. The beneficiary relationship is also optional. The claim filing indicator is a little tricky. It doesn't apply as much to dental, but if the member has Medicare through MetLife or Medicare through Molina, even though it is a commercial insurance, you would still need to select either MA for Medicare Part A or MB for Medicare Part B to indicate that it is a Medicare plan, even though it is through commercial. For today's example, we are going to select CI for commercial insurance. The total COB payer paid amount is how much did primary pay for this whole claim? What did they pay for the entire claim? For this example, they paid $26. Then you have the external outpatient remark code. This is also optional. The next field is section 1 and section 2, which has the external adjustment reason code. And what this is this is like the most common ones are 45 and 2, like 45 for contractual, 2 for patient responsibility, and so forth. And for today's example, we're just going to use 45 for our contractual. And we'll enter in our contractual, and the total contractual amount for this claim is going to be $10. The adjustment quantity is not needed. You could either put a 1 in there, you can leave it blank. Either way, it's not going to change the outcome of the claim. Now we're going to add in the patient responsibility, and for this example, we're going to do a 2. And we're going to select PR for patient responsibility. And the total amount left for patient to pay on this claim is $45.22. So this is all of the primary insurance information, and this is what we refer to as header. So this is the header details or the header primary insurance, which means it's for the whole claim. So as we continue down the form, we'll come to our claim information. We have the patient account number, and this can either be an in-house account number or it can be the member's Medicaid ID number. Enter in the place of service from the drop-down menu. You'll enter in the service start date. If it's a single date of service, the service end date will be the same date as your start date. Prior authorization, referral number will go in this section. We have a delayed reason and a claim notes section. If you click on the red plus sign, then it becomes required. If you click on the minus, which brings it back to the plus, then that field is no longer required. We'll continue with the questions. Is this claim accident related? Does this claim have backup documentation? Does this claim require a diagnosis code? When it asks about the backup documentation, if you click yes, it doesn't give you any other options. It just wants to know yes or no. And for Medicaid, we no longer need the x-rays or the EOB to be uploaded into the system or be attached to the claim. When you're filling out the claim, you're doing a DDE, which is your direct data entry. You're not seen as being in the main system. And for that reason, you will get a session timeout warning. It's important that you click on the click here option. It's in blue. When you click on the click here, it adds 10 more minutes to your session before giving you the warning again. If you click on the close button, or if you click on the X, after 5 minutes, it kicks you out and you have to re-log in. So we're going to click on click here for 10 more minutes. Next, we're going to go to the basic line information. And this is where we're going to enter our service line. So we're just going to enter in a date. The appliance placement date, we don't need to worry about. Treatment start date, that would, like when you're doing braces or something along those lines. Place of service, if you entered it in at header, you do not need to select it here at line. The oral cavity, tooth number letter, and the surface are required based upon the procedure code. The procedure code that we are going to use today is D0140. And the charge or the fee for that is going to be $64 even. And then I'm just going to read the rest of the information to make sure that I'm getting everything. Procedure description is optional. The diagnosis pointers are only needed if you have a diagnosis listed. A place for you to put your prior authorization, rendering, supervising if different than header, if this information is not already at header. Is the header service facility location also the service line facility location? Yes or no? We're going to leave that at yes, and we are just going to click on Add Service Line Item. When you click on that, it's going to refresh the page and take you all the way to the top. And we're going to click on Service, which will take us directly to our basic service line. So we can enter in our second line. Place of service, oral cavity, tooth number. I do believe we have a tooth number with this one. I'm just going to enter 29. And the procedure code that we're using for this one is going to be D0220. And our fee for this one is going to be $17.22. And then I'm just going to make sure that I don't need any other information. And then I'm going to click on Add Service Line Item. And I'm going to scroll all the way to the very bottom. And this will show me where my lines are. So we have line 1, line 2, data service, tooth number for line 2, procedure codes, the fees, and these will automatically add up and create your total fee. Okay. If you find that you want to copy or have a second line, just a different data service for this exact line, you could just click on copy. That's going to refresh the page for us. And then all the way to the bottom, you'll see it has the fee is the same, the code is the same, the data service. And then you can update that by clicking on the hyperlink line number. We'll click on 3. And click on service. And then here, you can change the date based on when they came in. So I just changed the date, and then I'm going to click on Update Service Line. And you're going to select Update Service Line anytime you make any changes. If you accidentally click on the line number, you would still click on Update Service Line. You're only going to use the Add Service Line item when it is new information being added. So click on Update, and we'll go all the way to the bottom. And now you'll see that it has a different date. If you decide you don't want this line for one reason or another, you would just click on Delete. Are you sure you want to delete this service line? Click OK. That brings us back to our lines. All right, so now we're going to add our primary insurance for the individual lines. So remember, I referred to the primary insurance that we added prior to the header primary insurance, and now we're going to enter in the line insurance, primary insurance. So we'll start with line 1. We'll just follow that all the way across, and we're going to click on the text that says insurance info. And that's going to take us into line 1. From there, we'll answer the question, does the beneficiary have insurance other than Medicaid? And understand, if you do not put primary insurance at header, it will not let you get this far. You can click on insurance info, and it will error saying that you need to enter in at least one primary payer. So you will need to enter in the information at header before you can come into the individual line. So we're just going to click on yes. And now we're going to enter our information. The primary payer responsibility is based upon the information that you entered in at header. So there should only be one option, and that is MetLife. So we'll go ahead and select that. And then this is the amount paid. How much did primary insurance pay for this line? And in this example, it's going to be 21. Then we're going to go down and do our section 1 and section 2. And for our external adjustment reason code, we're going to select 45 for our contractual. And the amount for CO45 for line 1 is $10. Oh, I apologize. It's actually 8. And we're going to select our patient responsibility, which was a 2 for the reason code. And our group code is patient responsibility, which is PR. And the total amount for line 1 that was left for patient responsibility is 35. And at header, I did put my contractual first and then my patient responsibility. It does not have to stay in the same order. For line 1, I can do patient responsibility first, and line 2, I could do contractual first. It doesn't matter the order as long as they're called out.
Yeah, I was just wondering, so the reason codes, is it just the ones that the insurance company gives us, or?
So all of this information you're going to get off of your primary insurance EOB, okay? And if they do not have codes that are listed on the agreement, then you can come, and let me actually put this link in the chat in this meeting real quick. So if it's not calling out what those codes are on your EOB, you can come here and you can find one that would best match what was happening with primary insurance. So if you notice here, the 2 that I'm using, it's calling out the co-insurance amount. Like I said, there's the deductible, your co-payment. If we scroll down to 45, which is what we were using for the CO, sorry if that was making any of you sick. It's the charge exceeds fee schedule maximum allowable. It gives you some more information as well that you can read into, but it gives you the basic of what that code means.
All right. Thank you.
You're welcome. After you've entered in the primary insurance information for line, the way to save it is to click on your basic claim form in the top left-hand corner. I also have a document that walks through the steps for the dental and the professional claims on how to submit a DDE, which is the direct data entry, along with adding the primary insurance information. And there's also an example of how to balance your claims, which we will go through here shortly. So we're going to move to line 2. And we're going to click on insurance info for line 2. Does the beneficiary have insurance other than Medicaid? We're going to click yes. Again, your payer, primary payer responsibility, there should only be one option. We'll click that. Primary paid, the total amount paid for line 2 is $5 in this example. And we're going to enter our CO 45. And the total amount of the contractual for line 2 is $2. And then for this example, we're going to enter in our patient responsibility, which is our PR2. And in this example, the total left for patient responsibility for line 2 is $10.22. And then we're going to go up and click on basic claim form, which will save the information. And then if you have something to write with on or about, if you want to pull that up, we are going to go over how to balance your claim. Okay. So there's a couple of steps that you do. You need to balance your lines, and then you need to balance your lines to your header and balance your header to your claim. So the first thing that we're going to do is we are going to balance our line. So I'll give you the information for the header. So if you want to write down header and put the word total and then write 26 by it. And then if you want to do a CO with the amount 10 and PR with the amount 45.22, then we will go get the line information. So we're going to click on insurance info for line 1. And so your total for line 1, if you want to do line 1 and then put total, then it's going to be $21. For line 1, the contractual is going to be $8. And for line 1, the PR is going to be $35. And then I'm going to click on basic claim form, and we're going to go to line 2, and we'll write down line 2's information. Again, we'll click on insurance info. So the question is it's an ortho related. It says, when entering a claim, is it true that the prior authorization number needs to be attached to the claim or the claim will be denied? If so, does it need to be attached to both of the prior auth boxes or just the claim line? When I am entering in the prior auth number, I have from the approval, PRISM will tell me the prior auth number is invalid, and then I cannot submit the claim. It's hard to know for sure without looking at it. And so what I would like to do is we can set up a meeting. If you want to email me and let me know that you want to meet to look at the prior authorization to see if it needs to be at header and at line, and if you wouldn't mind being like very specific, because my brain is going to be fried at the end of the day. So if you can be specific on what we're looking for, I can look at that. I can look into that for you. Is Emily still on the line?
I'm here.
Do you know if it has to be at header and at line?
It does not have to be on both.
I was wondering that, which makes me think there's something with the number.
Yeah, we probably need to take a look at the claim because it should, obviously it does have to be on the claim,
Right.
but shouldn't have to be in both spots. But yeah, let's take a look at the claim when we get it and then find out why it's doing what it's doing.
Thank you, Emily. So
Okay.
Cameron, do you want to go ahead and email me? And if you want to let me know what some available days and times are, then I can definitely look into that for you and get back with you, okay? And if you don't have a mic, if you want to use the email that I sent you, there should be a phone number that you can call in with, which would also allow you to talk. If you don't want to, that's fine too. All right, so for line 2, the total paid, primary paid was 5, the CO amount was 2, and the PR amount was 1022. We're going to click on basic claim form. And then we're going to scroll down to our header primary insurance information. So here we can see the total COB is 26, the contractual is 10, and the patient responsibility is 4522. So if you were able to, and I wasn't moving too fast for you, then you should have something written down similar to this. And what we do next is we take the total for line 1 and line 2, and we add those together. And it comes to 26, which is good because it needs to match the header amount. So now we take our contractual, our CO 45 for line 1 and line 2, and we add those together. And it needs to equal our CO 45 header. Then we take our PR2 for line 1 and line 2, and we add those together. And it needs to equal our header, which is the 4522. So if we take that information and we look at the totals here, our total COB is 26, our CO 45 is 10, and our PR2 is 4522. So now your lines balance your header primary insurance information. So what we're going to do next is we're going to balance our header primary insurance information to our claim. And we're going to do that by adding our total COB payer paid amounts. We're going to add 26 to our CO 45, which is 10. Then we're going to add that total to our PR2, which is the 4522. So back to our little sheet. If we add up all of our header information, it comes to 8122. If we scroll all the way to the bottom, you'll see that our total fee is 8122. So now your lines balance to your header and your header balances to your claim. So you'll be able to submit this claim and it should not deny for unbalanced. Okay, so we'll go ahead and we'll walk through submitting a professional claim. And I'm just going to reset the screen by clicking on my notifications. So again, you're logging in using the profile, claims processor profile. You'll go to your claim. You'll select your claim type. For this example, we're doing submit professional. And if you notice, we still have our hyperlinks for our provider, beneficiary, claim, and service. With our billing provider for a professional claim, again, this will auto-populate when you're logging into your own screen. One thing that is different is it does ask you to validate your address, and the address is validated through our USPS. If it does not, if it validates, it will say address has been validated. If it doesn't, it will give you an error, and at that point, I would have you reach out to our provider enrollment. The taxonomy code is required for our FQHC, our IHS. For the other types of providers, it is not, but that taxonomy code does have to be at the billing provider level for those FQHC and the IHS providers. And we'll just continue down. Again, we're going to answer the questions. Is the billing location also the servicing facility? Is the billing provider also the rendering? Again, they're only required pending on which answer. Is the billing provider also the supervising? Is this the result of a referral? The result of a primary care referral? Any questions so far? Okay, so we're back at our beneficiary ID, our beneficiary information. Again, the beneficiary ID is a 10-digit number and it starts with a 0. And the last name, first name, middle name, and suffix are based on the inquiry that you have for the eligibility of the member, date of birth, and the gender. This one also has the onset of current illness symptom date. If that pertains to you, go ahead and enter in that information. If it's not relevant to the claim, it is not required, so you would not need to enter in that information. Just below the beneficiary, we do have, does the beneficiary have insurance other than Medicaid? I'll go ahead and click on yes. And a lot of this information is the same as the dental claim as far as what we're entering in. Payer responsibility, for this example, we are going to do primary. Remittance date is not required. Payer ID, again, that's from the clearinghouse and it's based off of the individual insurances. And today, for our example, we're going to use Molina. Subscriber member ID is not required. Subscriber last name and first name, again, I would recommend just entering those in. Middle name, suffix are not required. Insured's group or policy number. For today's example, we're just entering in zeros. Beneficiary relationship is not required. And again, the claim filing is important. If they had Medicare through Molina, you would need to either select Medicare Part A or Medicare Part B, depending on the services that were rendered. For today, we are going to select CI for our commercial insurance. For this example, the primary paid for the whole entire claim. They paid $124. And they also have, on this example, we do have a 45, which is our contractual. And the total amount for the claim for our CO 45 is $95.17. And if you want to write this down as we're going along, then you'll have it when we get ready to balance. The adjustment quantity is not needed. On this example, there are two COs. So for this contractual, we're going to use 253. And then we're going to select our CO. And the total CO 253 amount for this claim is $3. And the adjustment quantity is not needed. We do need to add the primary insurance, sorry, the patient responsibilities. We're going to click on add another reason code. And in this example, the adjustment reason code is a 2. And we're going to select patient responsibility. And the total amount left for the patient for this claim is $31.72. And again, you get this information off of your primary EOB. Okay, so we're going to scroll down. Desiree?
So, for us, we see a lot of like auto as a primary payer.
Okay.
Would that be like auto medical, and then when they're paying out, they're just doing typically the 3,000 or whatever the limit is. So in that case, there's typically not an adjustment. Is that okay? And we're just putting in the patient responsibility that they're leaving them with after, or
So I'm really struggling to hear you. You're talking really, really quiet. You're asking about like the total amount paid. Like this amount, you're saying primary doesn't pay because it's due to an auto accident, or are you saying
so
there's
we
not a
see
contractual?
so we see like a lot of patients that have like Medicaid will be their only payer, but then it's an auto accident. So the claim filing indicator, we would do like auto medical, correct? And then typically they only pay out 3,000 or whatever the policy is of their limit. And then there's not any contractual adjustments or anything. It would just be them leaving the rest to patient responsibility. So we would skip the 45, correct? And then just do 2.
You wouldn't, you would only do 2 if 2 fits the scenario from here, right? But yes, you do need to have a patient responsibility, or Medicaid can never pay more than 0.
Okay.
If there is no patient responsibility listed on the claim, it tells the system that nothing was left for the patient to pay. And so that just tells the system that Medicaid cannot pay on that claim. And so if there's not an error with it, it will show as paid, but it will show as paid 0. Does that make sense?
Yes, it does.
Okay. Did that answer your question?
Yes.
Perfect. Any other questions? Okay. So you have relevant dates, which you can select or you can leave closed. Your prior authorization number, referral number, CLIA number. You also have an option for claim notes. And then scrolling down and going over the rest of the questions. Is this claim related to chiropractic spinal manipulation? Does it involve replacement lenses or frames? Is it accident related? And does it have backup documentation? Again, the only time that you would need to add an attachment is if you have a claim that denied for missing medical records or missing attachments. At that point, you can then come in and you can upload those documentations onto the claim. But like x-rays and EOBs, all of that information is no longer required for Medicaid. We have claim data, which is our patient account number. Again, this can be the in-house account number or it can be the Medicaid ID number. Place of service. And then on this one, our diagnosis code is going to be the ICD-10. Desiree, you're asking what about trip reports for air ambulance claims? I'm going to turn that one over to Emily. Are you still on, Emily? Because I know there was something with that a while ago.
No, she had to go to another meeting. What was the question again? I totally missed it.
What about trip reports for air ambulance claims?
I believe those are only needed if it's a EOP claim for non-emergency, or yeah, for I'm having a brain fart here. Emergency services for non-citizens. There we go.
Okay. So Desiree, are you asking about adding documentations or uploading attachments as far as the air ambulance claims?
Correct. I was told when we put in a claim for air ambulance claims, we needed to upload the EOB, the trip report, and the incident report because we have such high dollar claims.
Okay, then yes, it's probably due to, especially if there's two rides that day, like say there's an ambulance as well. I don't know that they're reviewed any other time. We don't review them unless it's a duplicate ride for the day.
Okay.
Desiree, would you send me an example and then be very specific to have me look at if attachments are needed for the air ambulance claims so that I can look into that and hopefully give you a more, not that Elena's answer wasn't definite. I realized how that was coming off. That's not what I was saying, but just for some verification.
Yes.
Okay. Thank you, Elena.
Yeah,
Appreciate
no,
it.
you're good.
Okay, so we're just going to enter in a diagnosis code, and then we'll continue down. And then anything, again, with the red plus sign, you can click on it to add more information, or you can leave it as the plus sign, which will then, it won't be required. Now we're to our basic line item information. And for this example, we're going to enter in the date of service. Place of service is not needed if we have it at header. The procedure description is optional. The procedure code for this one is going to be, let's see, 92014. Admitted charges for this line is going to be 191.75. Units, I'm just going to put a 1. No modifiers with this one. Diagnosis code, I'm going to enter my diagnosis code. And this is required, so you do need to make sure that you do have a diagnosis code that you can enter in. And then we have the prior authorization, referral, CLIA, rendering, taxonomy, if they're different from the header. Is this header service facility location also the service line facility location? Yes or no? And then below it is a space for your NDC, your National Drug Code, quantity, the unit, qualifier, the prescription link number, prescription date, and then you also have, and I'll open that up because we do have you asking about the air ambulance. I don't know if this part would go toward air ambulance as well as regular ambulance, but I can definitely find that out for you. And then we're just going to close that up. And our line information is already in, so we're just going to click on Add Service Line Item. We're going to click on Service, which is going to take us down so we can enter in our next service line. Yes?
So I do bill out for ambulances, and I'm having a problem with the modifiers.
Okay.
Like I can't do like scene to hospital. The S doesn't come up.
Okay. Do you have a claim that's denying for that?
I can't even get on a modifier if you hit S. Like if I do SH, it'll say it doesn't work.
Okay.
So I can do resident to hospital. So I've been having to change it to resident when really we're picking them up on the highway or not always at their house, but the S isn't working. I wondered if that air ambulance is having the same problem.
Okay. Would you send me an email and ask for a meeting to go over that? And would you call out the specific modifiers and also state in the email that those modifiers aren't working, and we'll see what we can do for you.
Okay, awesome. Thank you.
You are welcome. So the total amount submitted charges for line 2 is going to be $62.14. Units, I'm going to do a 1. Modifiers, it's not required for this code, and our diagnosis pointer is a 1. I'm just going to look over the rest of the claim line to make sure I'm not missing anything. Looks like everything is in here. So I'm going to go ahead and click on Add Service Line Item. I'm going to click on Service, which takes us all the way to the bottom. And here we are. The submitted charges are auto calculated, which brings us to our $253.89, which is our total submitted charges. And we have line 1 and the information for line 1 and line 2. And did I go over with the dental the copy and delete option for the lines? No? Okay. Yes? I don't know what silence. I did? Okay. All right. So we're just going to go ahead and click on insurance info for line 1. Thank you, Desiree. Does the beneficiary have insurance other than Medicaid? We're going to click on yes. We only have the one option, so we're going to click on our option from our primary payer responsibility drop-down. The total amount paid for line 1 is $94 even. Then we have our CO45 that we're going to enter in here, and the total amount for our CO45 for line 1 is $71.75. I'm going to leave the adjustment quantity alone. Then I'm going to add our second CO, which is a CO 253. And the total amount for our CO 253 is, let's see, line 1 is $2. And then we are going to add for our patient responsibility, which is add another reason code. We'll go ahead and click on that. And our patient responsibility was a 2. And then we'll select PR for patient responsibility. And the total amount left for the patient responsibility for line 1 is $24 even. We'll click on our basic claim form. That will save the information for us. Then we'll go down to line 2. We'll click on insurance info. Does the beneficiary have insurance other than Medicaid? We're going to click on yes. We're going to select our only option under the primary payer responsibility. The total amount paid for line 2 is going to be $30 even. Then we'll add in our 45 contractual. And the amount for line 2 for our 45 contractual is going to be $23.42. And we're going to add in our 253 contractual. And the total amount for line 2 is $1. Then we're going to click on our add another reason code. We'll put in our 2 for our patient responsibility. We'll select PR. And the total amount left for patient responsibility for this claim is $7. For this line, I apologize, $7.72. Then we'll go ahead and click on basic claim form, which is going to save our information. And this time, instead of scrolling all the way down, we're going to just scroll to our other insurance information. And if you notice right here, there's still only 2 sections showing, and we did enter a third one. However, if you click on add another reason code, that's just going to populate right below. So the information is still there. We'll be able to use that. Any questions so far? Okay. I am going to pull my sheet over and we'll just go ahead and start adding things up. So let's see, our total, so we're going to add how much primary paid for line 1 and how much primary paid for line 2. We're going to add those together. That comes to 124, which equals our header total. And we're going to take our CO45 for line 1 and line 2, and we're going to add those together. And that total does equal our header primary insurance total for the CO45. Now we're going to take our CO253 for line 1 and line 2, and we're going to add that together. And that also matches our CO253 at header. Now we're going to add our PR2 for line 1 and line 2. And that amount does equal our header amounts. So if we look at our header, we do have the 124. We also have the 95.17, the $3, and the 31.72. And when we did the dental, remember we only had 3 totals that we needed to add together. But because we have the total and then we have the 2 contractuals plus the primary, we're going to add all 4 totals together. So we're going to add 124 to 95.17, then we'll add the 3 to that total and the 31.72 to that total. So if we add our totals all together, it does come to the 253.89. So now we'll take that total and we'll see if it matches our claim amount, 253.89. So again, your lines balance your header balances your claim. So submitting this claim, it should not deny or err for unbalanced. And Grant, you wanted to know, would you mind doing one without any other payers? Is that what you're saying? Okay. So the difference is going to be that you don't need to balance this. You would just need to enter in all of the information, and then you should be good to submit. So I'm just going to say no, and it's going to say, are you sure? Oh, it looks like I need to delete my line level first. So we're going to go down. And again, clicking on that basic claim is just going to save the information that you're either adding or subtracting from there, and we'll do no. So now you go through, you answer all of the same questions as before. Your line information. You can add more lines, subtract lines, but if you click on insurance info, at least one other insurance subscriber info has to be entered. So this is one that does not have any primary insurance information on it. Once you've been through and you verified all of your lines are good, your procedure codes are good, all of that information is good, all you would need to do at that point is click on submit claim. If you wanted to save it as a template, you would just do save as a template. And then like I said earlier, you would come into search template to be able to find that template that you saved.
What exactly is the save template? Just basically so we're not having to go through
Yes.
every time and put in all the info, we could just kind of modify it to what we're putting in.
Correct. So when you save a template, let's say that you have 5 codes that you use all the time, okay? Then what you can do is you can come in here, and I'm just going to go all the way to the bottom really fast, I apologize, and you can have each line entered into your template, okay? And then your data service, you're like, oh, I actually only did 3 of these codes that are listed on my template. So then you would just click on delete on the ones that you're not using that day. And then you would click on update change your data service and what other information you need to. And then just click on update service line and you're good to go.
Okay, that makes sense.
And then Trisha entered in the chat, do I need to void a claim and resubmit it since I did it wrong? If so, how do I do it? So that's, Trisha, going to be part of the adjustment training that we have coming up. But also, if you have a claim in paid status, the claim status is paid, and you have a pay cycle date, then you can go into the system and adjust it without having to void it. So again, the claim status has to be paid and it has to have a paid cycle date. It has to have those two things, and then you can go in and you can adjust it, you can void it, you can do what you need to it.
Even if it has a denial?
If one line is denied and the rest of the claim paid, then yes, that is true. It has to have that claim status of paid with the paid cycle date. It cannot be a denied claim. It can be a denied line and a paid claim, but it cannot be a denied claim.
So at that point, I'd have to redo it.
Correct. If
Okay.
it is not the paid if it's not in paid status, then yes, it will need to be submitted. Now, when you are submitting a corrected claim, if you are going through your clearinghouse, you do not need to indicate that it is a corrected claim. At that point, you would just submit it as a new claim because the original claim denied in our system and will not recognize it as a corrected claim or an adjusted claim. So if you're going through your clearinghouse, you would just submit it as a new claim. So you wouldn't use the 7 or the 8.
Okay. I try and do all my claims through our clearinghouse, but for some reason, all of mine that have a primary insurance, I can't attach to you guys. And so I don't know how to do it. I don't know. My clearinghouse says it's on your end. You guys tell me it's on their end. So I'm at a loss.
I will tell you that PRISM is not getting along very well with the clearinghouses. And I would just say it's a personality thing versus one or over the other. So you just need to learn to talk. But we are having some issues with the clearinghouses and primary insurance, which is why this is such a huge thing. And so many people are looking into this DDE option, which is the direct data entry, is because it can bypass that information. If you would like, go ahead and set up a meeting with me. And again, just be very, give me a lot of information as to what for. There are some things that can be done to help communicate better between the two as far as your segments and your loops. And so if you have, when we meet, if you could bring like the raw data to show us which segments you're using and which loops you're using, then we can try and help and guide you that way.
Okay, perfect. Thank you.
You are welcome.
So I do have it is along the lines of voiding a claim.
Okay.
When I put in the TCN on the one that was paid and 0, to adjust it, I was told the system didn't recognize the adjustments. So to void it and do it again. So then, and she gave me a different TCN to use. And so when I used that TCN for what I'm assuming was the one that I tried to adjust, it's saying it can't be found in the system.
Okay.
And then when I tried to use the original TCN, it says that one can't be replaced or found either. And so now I don't know how to go back and fix that. Do I just do like a whole new claim, but then what happens to the one that was paid in 0?
Right. Will you send me the TCNs that you're having issues with, and I can look at that? I don't know that we would necessarily need a meeting for that. It sounds like I might can just answer that through email, but if you will send me that TCN, I definitely can look at that and see which claim you could use if you could use a claim. Does that make sense?
Yes, thanks.
Okay. You're welcome.
One of my agers is asking if there is a way to view the EOB through the PRISM portal. Do you have an answer
Absolutely.
or no? Okay,
So I'm going to walk you through it. Let me
Okay.
know when you're ready to write down.
I am ready.
Okay. So you're going to log in under your claims processor profile.
Okay.
Okay.
Or
Next,
EDI.
um,
EDI would have, doesn't that?
yeah, but they get more with the claims
Oh, okay.
processor. And then they don't have to swap profiles to go and look at the other information. So less back and forth if you use the claims processor. So you're going to use your claim processor.
Okay.
And then you're going to go to My Inbox.
Okay.
And then you're going to scroll down and select Archive Documents.
Okay.
You're going to change document type from all to claim documents. And then you're going to click on Go.
Okay.
On the far left, it should say document type, document name, I think. It will say paper RA and it's in blue. And that means that you can click on it and it will open up and it will give you your remit. There is, before you click on the paper RA, there is a scanned date column. That scanned date correlates with the paid cycle date. So if you're looking at a claim and you see the pay cycle date of 1/25/25, then when you go into your My Inbox and you're looking for the remit that matches that, you're going to want to look for the scan date that has the 1/25/25 date.
Can you repeat that last part? You said before you click the paper RA in blue,
Yeah.
you said scanned date.
So there is a scanned date column.
Okay.
So it has document name, document type, scan date. I think it has size. Not 100% sure what all of the columns are, but the scanned date listed there correlates to the paid cycle date listed in the claims inquiry or in the claims itself.
Okay, perfect. Thank you.
So go ahead. Your next step is going to be to click on the blue paper RA, and that is going to open up your remit. On page 2 in the upper right-hand corner, it's going to have your RA number, which you can use in your claims tab. The other thing it's going to have on page 2 is it's going to call out how many claims were submitted, how many paid, how many denied, how many are a result of a gross adjustment. And then as you move further into your remit, you'll have a claim that has, like it will end in 00, and that's your header TCN. If you go all the way to the right, you'll see like reason code, remark codes. So if you have a reason code or a remark code with the TCN ending in 00, that means it denied at claim level. If you have the exact same TCN and it ends in a 01 with the reason and remark code, that means it denied at line 1. And those lines are based on the claim that you sent in. So if it ends in 01, it's line 1. If it ends in 05, it's line 5. If it ends in 10, it's line 10, right? And so that correlates with the claims that you submitted. And so you'll be able to use the reason and remark code and be able to go and find out why that denied and which line it denied on.
Okay, perfect. Thank you.
You are welcome. Do you know how to find the denial code list?
Our ager probably does. I could ask for that question.
Let me go ahead and share my screen and I will show you where that's at.
Okay.
Let me know when you can see my screen.
Yes, we can see it.
Okay, so you're going to go to medicaid.utah.gov. You're going to go to providers,
Mhm.
claims,
Mhm.
and we're going to click on learn more under claim denial code list, CARC and NARC. Everything in green is your reason code. Everything in blue is your remark code. Everything in red is what the Medicaid staff sees. So you can use your remit to find out what those codes are, and then you can come in here and you can see what the description is of those, which will give you more information as to why that claim is denying.
Oh, perfect.
Along with your remit, if you take that RA number that was on the second page in that upper right-hand corner, if you take that and you go to the Claims tab, and you scroll down to RA List, under RA List,
Mhm.
you're going to filter by RA number, and then you'll enter in that RA number that you copied from the remit. Now, the RA number is also in the claim down at the bottom with your submitted charges, with the paid cycle date, and so forth. You can get the RA from there. You do not have to go into the remit for that. Once you've entered it in the filter, you just click on Go, and then that is going to bring up like your warrant number, your EFT number. It's going to do a transaction count, which is how many claims are associated with that remit. It's going to give you a paid cycle date. From there, you're going to click on the blue RA number, which will then open, and it will take you, so I call it the interactive RA, because from there you can click on each of the individual claims, and you can go in and you can look at the lines and the procedure codes. You can look at the member information. You can see what providers are listed on there, if there's more than just the billing provider, and so forth.
I was going to ask, are you going to go over anything with the atypical providers and how to bill through the PRISM through being an atypical provider?
So when you're using the atypical provider, the
Yeah.
difference would be up here, instead of your provider ID being your NPI, you're going to want to use your provider ID.
And then will some of this automatically populate, like the units or the cost per units? Will any of that auto populate, or do we have to add all that ourselves?
I do believe you have to add all of that yourself. Justin is nodding. Thank you. The only thing that populates on its own is when you use your domain, which is your NPI, the information here will auto-populate. One thing that is helpful, if you're using a clearinghouse and you are submitting claims through PRISM, if your TCN starts with a 3, that came electronically. If your claim number, your TCN, starts with a 2, it was submitted this way through PRISM.
Okay.
So that can help you see the difference when you're looking at your claim numbers on how it came into the system. Another way is when you go into the TCN, it does call out the source, which does say like web batch, or I think it does say direct data entry. It will cross over Medicare. It will call out how it came into the system. And Justin, you are correct. The 4, if it starts with a 4, then it's been reprocessed or adjusted. So if you have a claim that paid, and here's this example again, you don't want to click on the X in the top right or the close in the bottom right. You want to make sure that you're always clicking on the click here in that blue text, and that will give you 10 more minutes. If you have a paid claim and you adjust it, the new claim will then start with a 4, indicating that's been reprocessed.